the blood vessels themselves is determined by the heart, right? When the heart contracts, it's called systole, and when the heart relaxes, it's called diastole. So the most pressure is felt when the heart is contracting, and the least pressure is felt when the heart is relaxing. And so usually when you get your blood pressure taken, it's reported as how much pressure is there at contraction and how much pressure is there at relaxation. And we make that into a fraction. So contraction over relaxation, usually people have a pressure of about 120 over 80, but there's a lot of variation in there. You can feel this pressure in your arteries as a heartbeat or a pulse. Some factors that can affect how well your arteries are moving blood and how well the walls are expanding and contracting to allow for pressure. So we measure the movement of blood in a couple of different ways. The first one is called stroke volume. So this is just a measure of how much blood leaves the heart every time the heart contracts. And it's typically about 70 milliliters, which is really not very much. I'll show you in class how much that is. We can also measure in terms of cardiac output, which is usually in a value measured over 1 minute. So the volume of blood, how much blood is moved out of the heart in 1 minute. Those two things are very closely related to blood pressure. If you increase either one of these, then the blood pressure increases. So if you have more volume leaving the heart, then there's more pressure. That probably doesn't surprise you. In your body, you have about 5 liters of blood. So that's a little bit, it's about 1 1/4 gallons of milk in the whole body. As if the blood volume for some reason decreases, your blood pressure drops as well. So things that might decrease blood volume are usually dehydration, because your blood is about 50% water. And so if you have low water in the body, then the blood has less water. And if there's less water in the blood, there's less total volume, which causes your blood pressure to decrease. A more severe cause of blood pressure decreasing would be called hemorrhage. That's when the body has a serious injury. So maybe you know, there's been a car accident and your leg is broken and it's bleeding severely. That would cause a lot of blood volume to be lost. Sometimes there can be internal injuries that are bleeding, and so blood is leaving the blood vessels, and that also causes blood pressure to decrease. This is the last kind of look at other factors that can alter blood pressure. Peripheral resistance. That means how hard is it to move blood. Peripheral is around the body, and resistance means working against it. So the more damage there are to vessels within the body due to plaque or other injuries or just general lack of exercise, the harder it is for the body to move blood. And so that increases blood pressure. If it's working harder, it's usually the blood pressure increases. Blood viscosity is the other one. So that blood viscosity measures how easily the blood flows. So viscosity, high viscosity means thick blood. So again, if you have clogged up your arteries with a bunch of fat and other things like that, that means the blood it gets really thick and the body has to work harder to pump it. Think about trying to, sometimes if you have a milkshake and it's really, really thick and you're trying to use a straw to drink the milkshake and it's really difficult to get it up into the straw because it's really thick, it takes a lot more pressure than, say, drinking a soda through a straw. Soda has very low viscosity. It easily flows, and so it requires very little pressure to move it. So the higher the viscosity, the thicker the blood, and the higher the blood pressure. We will talk more about this in class, and we'll do a couple of lab activities looking at all of these different factors. Please come in with 3 clarifying or other questions and a summary.